So many components go into e-cigarettes and the various brands. What questions should those likely to pick up a product be asking themselves?
Well, the most important thing is that e-cigarettes are not safe. The only people who should be using e-cigarettes are those trying to quit smoking cigarettes. So it really is not a harmless product. Kids should not be using these products, as well as adults who aren't using any other tobacco products.
Tell us about the kinds of components we should be thinking about, though. It's not just a question of some oil getting heated up. Various brands have different things inside their products. Give us some of those questions.
Well, there's a vegetable glycerin and propylene glycol solution, which are water or alcohol-based solutions, and in that, manufacturers often put nicotine and often flavors as well. So we have to think about a couple things. One is the nicotine delivery that the user gets from the e-cigarette. That's a function of how much nicotine is put in the solution, as well as the formulation of the nicotine. And we have to think about the flavors too. The flavors are really attractive to kids, as we've seen. The vast majority of kids who use e-cigarettes are using flavored e-cigarettes.
Now, there is some talk about them being a way of quitting smoking itself, but how much do we know about these products being a gateway themselves to nicotine products?
Well, that's right. I mean, we're still learning more and more. We need additional studies, but unfortunately, e-cigarettes in this country have become a public health disaster. When e-cigarettes first came onto the market, the high hopes were that they would be an off-ramp for cigarette smokers. But instead, they've been an on-ramp to nicotine addiction for our nation's kids.
Dr. Cohen, explain to us why the FDA is allowing the sale of these products and allowed it at the beginning, given that there's so little that we actually know about them and their effects.
Well, the FDA tried to regulate these products as soon as they came onto the market. They tried to regulate them as smoking cessation devices because that's what we thought that would be the promise of e-cigarettes to help cigarette smokers quit smoking. But companies sued. They did not want to be regulated like smoking cessation devices. Instead, they wanted to be regulated like tobacco products, and then it took some time for the FDA to deem these products to be able to regulate them, and they're now working on proposals on how best to protect the public health.
Should we be taking lessons from Europe? Europe does seem to be doing a better job regulating e-products. How would we do that?
Right. Well, the European Union has a number of regulations on e-cigarettes, including giving a limit on the nicotine concentration that's allowed in e-cigarettes. But we do have to be careful about just trying to push the balloon in one spot and not have another piece of the balloon expand. So there are a number of factors in e-cigarettes that control the delivery of nicotine to the user. One of them is the concentration of nicotine, but the voltage, for example, in the product also contributes to how much nicotine a user gets. So you could have a nicotine liquid with a concentration that is allowable in the European Union, but ramp up the voltage and the user will get much higher levels of nicotine. So we have to be really careful and thoughtful in how we regulate these products.